Thank you, Mr. Speaker. House Bill 1105 allows pharmacists to do what pharmacists have been doing for 3 years, and I move
Mr. Speaker,
Mr. Tinderholt, for what purpose?
will the gentleman yield for a handful of questions?
Would the gentleman yield for questions?
I yield.
The gentleman yields.
Thank you so much, Mr. Price. And I have the utmost respect. We talked about this yesterday. I wanted to ask a few questions before we vote. With this bill, if someone already had a chicken pox vaccine, might a pharmacy not know that compared to a doctor?
It's hard. It's a hypothetical. I suppose that could happen, but I don't know how to answer that question.
And also, I don't believe that a pharmacy tech or a pharmacy might not know that the individual already had a chicken pox, had the chicken pox itself. Could that be a possibility?
Well, there are forms that they sign when they come in, parental consent, for instance, for minors, and then a history, and so they are supposed to indicate on that if they've had it. So if they fill out the form incorrectly on the consent form, it's possible someone wouldn't know, but I believe they would know if it's filled out correctly.
And are you aware the federal government's paid out $5 billion to date to compensate victims of vaccine adverse events, with more payouts in FY22 than any other since the program? Were you aware of that?
I am not aware of that, and I don't know that that's solely for childhood routine immunizations.
You're exactly right. It's not just for childhood, it's overall.
Okay.
And then I have two more questions. Are you aware that the federal VAERS system shows over 3,000 reports of adverse events in the 3 to 14 age group in Texas in the last 3 years?
I am not aware of that.
And lastly, do pharmacists typically have access to full patient medical history or medical records or emergency visits like a doctor would when they give these vaccines?
The records are definitely different, yes.
Okay. Do you think that could cause some issues like double vaccinations or anything like that?
I don't believe it could.
Okay, thank you for answering my question, sir.
Thank you,